I think communication is a big part of it. We have an excellent system where nursing communicates with the therapy department and the therapists, the various disciplines within themselves. So if a patient's going for an appointment or has something going on with family, we try to work around their schedule and we try to keep OTPT speech at a certain time. So we try to stay productive, we're focused on our patients, and we make use of our rehab techs so that transportation of patients is not counted against us as downtime.
Great. For communication between therapists, we do everything through email, so it's really fast and quick. We can get answers right away. We also have a messaging system in our documentation program, so we can message other therapists regarding, our guests and any questions we might have right there at our fingertips.
So I first let them know that I'm listening to them, and I understand that every day can be a struggle sometimes, and that sometimes we don't work in the ideal conditions and everything isn't perfect, but then we go over their day. I like to pull their schedule and I like to sit down and be like, okay, so what happened between this time and this time? And what are some strategies that maybe we can make it better? So I would say like therapists who work later during the day sometimes struggle a little more because family members will come in, ask questions, and I always tell them, feel free in a polite manner to tell them, that the rehab director will call them in the morning with updates that we want. Because if you're with another patient and that's not the patient that they're asking you about, that can take a lot of time out of your day. If a family member after family member is coming down asking you about progress, tell them we'll set up a meeting. The rehab director or social services will call them as soon as they get in the morning, and then just leaving me that message so I can kind of take that off of them and help them out in that way. I try to talk to, I would say the CNAs on every hall, but especially the rehab hall, and making them feel like they are with us in the patient going home. Like, you're a big part of it. We only see them X amount of hours a day, but you're with them a lot more than we are. So it's important that you know their goals and you know what they're able to do on their own, and that you encourage this and this to happen. And I think when they feel like they have a responsibility, or because their job is just as important as ours, but sometimes they don't feel that way. So I think just having a good relationship with the staff and kind of letting them know like you're as important as we are. And sometimes they want to work a little harder with you, for the patient, that kind of stuff.
I agree completely. I think it's developing rapport with the facility staff, whether it be CNAs, nurses, whomever. And that can take time, but once you get it, then, you help them out, they help us out. It's definitely a mutual beneficial relationship.
And we actually provide the nursing staff with the therapy schedules, so they know who needs to be up in the morning. And if they have a struggle with somebody, they come and tell us. It's like, look, I'm having troubles, or they're a 2-person transfer and aren't able to find another person, so they come and get us. So, but it is the rapport, the communication, just in letting them know that we're here for them, just as much as they're here for us.
One of the common themes, because the directors of rehab were a cross-section of companies, and they were successful leaders at what they do. And I think some of the themes that came out is how important communication is, and how important support is, supporting their team and problem solving, and having their team members feel like they're supported in the process. And certainly systems came in place, but if anything, it seemed like communication was the number one, over communicating.
Right.
And I know, as I sat and looked at the traits of those rehab directors, they all felt a personal mission to support their team, to be there for that team, that sense of, I'm gonna not only support them, but collectively the attitude that we have as a team about what we do every day is gonna be good and solid, and that team spirit, that attitude seemed like something that they were really committed to as well.
Right.
It was interesting because prior to this, had talked to some people, we expected them to say documentation is a challenge. We expected them to say scheduling is a challenge. And we expected them to say patients with medical complexities, because we're seeing more of that as patients that have less medical complexities are going straight to home health or straight to outpatient. And that's not what they said. Certainly scheduling was a top one, but communication and support were
Right.
far above
It
that.
was, yeah.
Yeah.